I'm privileged to welcome the Honorable Speaker, Professor Dr. Moorthy sir. Sir is a consultant rheumatologist, University Hospital of Leicester, NHS Trust. He is the Honorary Associate Professor of University of Leicester, UK. Sir is the Regional Specialty Advisor of Rheumatology, Royal College of Physicians, London. And Sir is the Honorary Professor of Rheumatology, Tamil Nadu Dr. MGR Medical University, Chennai. Sir is also the Honorary Professor of Rheumatology in New Bison University, Georgia. With this very brief intro, I would like to welcome our Honorable Speaker, Dr. Moorthy sir. Welcome, sir.
Thank you, Venkatesh. Let me share the screen and we will start doing the presentation. Okay. Can you all see the slides? Yeah?
Yes, sir. We can.
Okay. Thank you, Venkatesh, for your kind introduction. Thank you for inviting me to deliver this most needed thing. Because when I left India in 1996, we didn't have this sort of opportunity or interest and support from the local organization. And I would like to congratulate the IMA, Junior Doctors Network Forum, and particularly Shiv and you to put this platform together. And I'm also joined by two of my aspirant doctors who just starting their career in UK. So it will be a good practice for them also to explain their journey to the people. So as Venkatesh introduced me, I am working in Leicester, and I've been doing these talks for some time for Indian medical students when I visited India more often then, but obviously COVID put everything into a halt, so I was not able to deliver. So this is a good opportunity. I'm really, really thankful. And I also would like to thank Jailal, who is my 1 year junior in my school days. And I think he's doing a good job. Thank you. Let me move on to the slides. So the first question, when you all answer, this is the first question which when you're planning to come to United Kingdom, you need to ask, why do I wanted to train in UK? That's a question we need to ask first yourself, because there's various reasons people choose to come into UK. So why? That's the first question you need to answer to start your career or your journey to UK through whichever route which we are talking about. One of the route which I'm going to talk about is Plab Route. So United Kingdom is an island. It's not, slightly bigger than Tamil Nadu state or, Andhra Pradesh combined, surrounded by sea, obviously 3 or 4 seas, and it is England, Wales, Scotland, and Northern Ireland. This is all called United Kingdom. So if you start career, you can choose any of this part of England and then get trained. And then if you would like to settle down, you can settle down. So that is a very small country with a good system, which is a National Health Service. The National Health Service system is the largest and one can say the greatest healthcare team in the world. So this system is free at the port of delivery of any patient coming into that. We also have the same system when British was ruling us in England, India. They have all these government hospital setting, primary healthcare, secondary healthcare, tertiary healthcare. We do have a similar approach. And obviously in England, it's still very well regulated and very well supported. There's a lot of advances happening regularly, and the working pattern can be slightly different than in India. And here we all work as a team. In India also we do work as a team. Here it's a team discussions happening all the time. It is nobody superior to other, nothing at all. I'm a professor, I can be challenged by my junior doctor during my ward rounds. No, I can't see the result correct. So that is a system which we are. There's a lot of empathy, and the nursing and the doctors show to the patients, though it is a treatment delivered in a free way. So that is a huge advantage of the National Health Service, is the system where you will be looking to work. And obviously the hospitals are very old hospitals. If you can see the building, this is my hospital where I work. And this is what it is, my hospital is 200 years old hospital. and the buildings are still 200 years old. So you feel like, working in completely different environments. I mean, all these red buildings in Madras Medico, they used to call anatomy department as a red fort. Like that, you can see that all these things are red, all the buildings are red. And when you are working there, where you get further training in your post-graduation. That means you don't get into like an MD or MS or anything like that. The Health Education England is another system by which they support your training by supervision and regular assessment, and then certify you at the end of your training. So that is where the Health Education England is one of the best organization. So NHS is one, and the Health Education England is another good organization which deliver further postgraduate medical education and training. So you will get the opportunity to work and get trained by Health Education England. And while you are doing, you will be writing exams for the chosen specialty. For example, if you are interested in MRCP, general medicine, then you will be getting a part 1 exam, part 2 exam, and at the end of the day, you will get a degree, which is a very, very valuable and invaluable degrees across the world. So you got MRCP, that's what the certificate you get. There's a very good ceremony which they happen. You will feel very much privileged on the part of the group. And once you become member of Royal College of Physicians, then you become a fellow of Royal College of Physicians after a few years of achieved your post-graduation qualification. So as a fellow, I'm the fellow of Royal College of Physicians. We have all these meetings regularly. So this is, you can join an eminent people like lots of professors and lots of scientists, and it would be just, I met the Dr. Kumar and Clark, the the author of the textbook of medicine. And she sat next to me and then signed one autograph for me. And I said, Moorthy, why do you want to get autograph? We all love that medicine book. So you mingle with these sort of people very casually, and they're all down to you. They are very humble. So that sort of things, you will get it in a group in the joints in goodness. So that's another thing, which is this country teaches you. And then obviously each hospital is attached with the university, and that is what is called teaching hospital. So Leicester is an university hospital, and I am attached with the University of Leicester. This is our university main building. What it is, I am the associate professor there, and it gives me a plenty of opportunity for me to do research. So research is mainly to identify some unanswered questions and then write and then do some research. And this is our hospital research space. It's a dedicated research spaces are available in each hospital, and each hospital have the National Institute of Health and Research, a facility will be there. So while you are studying, while you are training, you will be given opportunity to do research. When we were doing a master's in India, we don't have that much opportunity. Here, you have a dedicated research unit and you have a dedicated time in your place to do research. So you get training, you get qualification, you get research, and you need to get into more on that one. Of course, the life in England is completely different. I mean, this is very clean city, and this is Big Ben, and this is the Westminster, and this is the London Bridge. And you can see the London Bridge buses or double deckers and lots of natural beauty there. And this is the Windsor Castle where the Queen and other people say, and there is castles, plenty of castles, which tells you about the history where you can go and spend your time leisurely. So it's a beautiful country to, when the weather is good, it is a good country, and greenery and sceneries are very good too. So there's plenty of reason why you wanted to come to United Kingdom. Then you think about, why that same question is asked. Yeah, better training with international recognition and greatest research opportunities. And also the pay is adequate for you to survive, and then you can make good money out of it. And it's a better work and personal life balance, which is a key thing. And, obviously some people are chosen to have different specialities, but it is after 9 to 5, you are switched off. That means nobody will be asking you what you do, and that's on call. So Saturday, Sunday, you are off, and then you have 3 to 35 days of annual leave. And that 35 days, I'm completely switched off, wherever I wanted to go and come. So when I'm coming to India, 3 weeks annual leave, my patients are looked after by somebody else. So that sort of system. So it's a better work-life balance and also good NHS pension for you to support in future too. And better lifestyle, obviously. And obviously this legislation and regulations are very, very tight. Whether you are Prime Minister's son or you are a porter's son, all are treated equally. The law is strict. So it is not like you have some influence, you can escape the route. So now you answer the question why I wanted to come to United Kingdom. That is a question you need to clear in your mind. And then you decide how I need to get into United Kingdom to pursue my career in the United Kingdom. So there are different routes, but I was asked to talk about the Plab routes. So we'll just touch upon Plab route. So your dream of postgraduate training in the UK is very, very achievable. That's what I wanted to say. Positive thing is you can achieve that one. Yeah. And if you prepare smartly, you can easily achieve. You need to seek right advice and guidance from people who will be able to guide you, like Sai Niranjana and Dr. Karthikeyan is here today, and they just came out from the other end of the Plab route. So if you get advice from people that just passed or people who have been examiner for Plab and etc., we could able to help you and guide you on that one. So this is where it starts. After qualification in India, so you need to have some understanding about this system of the training in India and England. In India, after qualification, you do 1 year of housemanship or house surgeon, CRRA. Whereas in England, you have to do 2 years of foundation training program, which is equal to our house surgeon C. However, the 2 years, the first year is 1 year they work as a provisional registration. And the second year, after completing the second year, they will be getting a certificate to work or the registration, like our provisional registration and permanent registration in Indian Medical Council, similar to that. For that, you have 2 years. When you come from India, you will be joining the second year of the foundation training program. So that is where your starting point is. And then you get the GM's registration to work for that in the UK foundation training program. And some of them are provisional registration from India is also accepted, the training you get, but you may need to do 1 more year or you may show them on state. Then you can move on to the next stage of training, which is the next stage of training is either you opted to go into medical training or surgical training, or you can choose to do primary health care training. So these 2 stages of training, whether you are medical training or surgical training, at the time you will be completing or you are expected to complete your MRCP qualification or MRCS exam. And the stage 3 is your specialty training. So you will go for various training of whichever specialty you do. And after the stage 3, you will be expected to write an MRCP exit exam in general medicine. In rheumatology, you can do MRCP rheumatology. And then it takes at least around 9 years from when you start here to, if everything goes well, minimum 9 years before you become a consultant. Okay, the consultant is the top post where the foundation doctor and the core medical trainee, specialty doctor, and a consultant. This is what the last level will be saying on that one. So this is what the shape of training, which is started last year, which is now changed, like 2 years of foundation training. Now they changed into 3 years of internal medicine. I'm just talking about medicine here because I'm a physician, but obviously this all mirror with the other training as well. So you need to have 3 years of IMT course, which will be at the second year you finish, and third year you will call as a medical registrar. And then you go into another selection criteria to get into what we call specialty training in internal medicine. There you write your specialty certificate exam. You will be assessed knowledge-based answers, and then you go for the postgraduate credentials and you become a consultant. So this is what certificate of specialist training, which is called CST. Without CST or CCST, you will not be eligible to work as a consultant. So that degree, which also they given a proper certificate for that, that is recognized worldwide as well. That is recognized. If they say I'm a rheumatologist, do I have a CCT? Yes, I do have a CCT. My name is registered as a consultant rheumatologist, trained in UK in rheumatology. that speaks volumes for other country people. They wanted to employ me. So for example, in Middle East or in Australia, American countries, we can go and we can get into the employment. So there's a plenty of opportunity for that. That's the shape of training now. So you need to understand where you start when you come to this country is you will be coming here rather than straight jumping into that one. Some people, those who have MD general medicine or DM rheumatoid, DM something like that, they may choose to come into a different route called medical training initiative, which is a route which doesn't need Plab exam, but thus can go through different process. I'm just appointed a medical training from India to come and work with me as a medical training initiative in rheumatology for 2 years, and I expect it to arrive next year. So there are different routes. So we are not touching about that. I just wanted to give you a feel of what is happening in the training scheme. And now you understood the training scheme, and we need to start how we start from these postings. So first of all, when you decided to write Plab, what you need to do is you need to check your primary qualification and medical school are recognized by General Medical Council in England. If you go on the GMC website, and you can see, is it the acceptable medical qualification I have? So maybe all these old and medical schools are already registered. Some new private medical colleges are not registered, or you are the first person appearing from that medical school, then you need to go through various processes to get that one. So make sure that your primary qualifications and medical schools are acceptable medical qualifications, and then you create a GMC online account. That's General Medical Council. It is a very powerful organization in England. So it's regulating doctors, ensuring good medical practice is happening. If they put my name, everything will come out on the public domain. So everything in public domain, and people can complain about you to the General Medical Council, or concerns will be raised. And then it's lots of, it's very strict. GMC regulations are very strict, and everything is governed by General Medical Council. How we train our junior doctors, how I am treating my patients, how I am behaving in work, outside works, everything is monitored by the Medical Council, particularly when you are posting on lots of messages in social media. I had to be very careful. General Medical Council, somebody reported, then you will be in trouble as well. So when you decided to come to UK and you checked your primary qualification is suitable and you create an online account, then the next question is you need to write the IELTS exam. That is an English exam for showing your proficiency in English in different components. That is the World Speaks IELTS, or there is another test called Occupational English Test, but I would recommend you to do the IELTS, which will be very useful for the visa purpose too. The Occupational English Test is also, it's mainly professionally we are qualified and we are coming in a different type of visa. So the IELTS is an international English language testing system. I do know that lots of training centers are opened up like a mushroom in India, and they are, people are good in listening, reading, and writing and speaking. These are the 4 components will be tested: how you listen, how you read, how you write, and how you speak. So each component will be assessed, and you need to get 7.5 overall, and you need to get 7 at least in each sessions. So the IELTS UK VA Academic is the one which is we would suggest for the type 2 visa to get in. So all are very good in English, and you all studied in the good schools in your primary school onwards. So it is a reasonably easy exam to pass, and this exam is only valid for 2 years. So you have to plan accordingly before you write your IELTS exam. So listening, and then reading, writing, and academic reading and academic writing. And also they will be assessing how you are speaking, and somebody will be able to do that. And how do you prepare that? It is all there on the domain. So listening 50 minutes and reading an hour. And sometimes they will be asking you to write some for and against debates and things like that. And speaking specific content, any topics. It's just see how you are understanding. So listening, and then how you're communicating. So these are very important to talk to patients in United Kingdom. So that's why very key. If your English is not good enough, then you will struggle to communicate with the patient. Communication is the key to be a good doctor. When your communication is not good enough, then it will create lots of problems. That's why it is very emphasized on that one. It's 2 years, and it's happening quite often. And you could register and get that one. And you can get more information on this website. I'm sure nowadays you people are very well versed in the internet, and you can able to get more information on that. Right? So now you pass the IELTS exam, and while you are preparing for IELTS exam, you also prepare for that exam. The preparation start from, there is a course called IELTS Advantage, and the most importantly, British Library, and that's a lot of embassies which is there in your, in your city. Visit them, and that will also help you to identify those things. And watch BBC. You don't need to speak the exact accent what the British people are talking. You talk slowly, give gap, and speak loudly and clearly. You don't need to talk like an Englishman. Yeah, don't change your accent and talk properly. And you can see the BBC news or BBC debate shows, which also help you to improve the way which you speak. American English is completely different. British English is what we were all taught. And I would recommend to talk slowly and clearly with a space. Then you can able to pass this exam. And then once you pass the IELTS exam, then you need to start registering for Plab exam. So Plab, what you need to understand is Plab is not a qualification exam. A lot of people ask the question, so I'm qualified with the Plab. You can't put your name, you can't put these Plab letters after your name. It is only an entry to United Kingdom medical system. Okay, it's not a qualification. It allows you to practice United Kingdom initially, temporarily, and then you will get permanent registration. That means you can come and practice at the level of your expertise once you pass your Plab. And it is only for international graduates, and it will be an international exam. Mind you, this is not only people from India writing, it's all people all over the country, world writing. So the questions and the answers are set up like the standard which is expected from a doctor. And it's a board test. It helped the GMC to make sure doctors who qualified abroad have the adequate knowledge and skill to practice medicine in United Kingdom. So the knowledge should be adequate, and you should be a safe doctor. This is what they are looking for all the time. So that's what the Professional Linguistic Assessment Board exam, which is called Plab, will judge you. So what they judge you is not, the first page of Harrison to the last page of Harrison. No, they will look for your knowledge, common knowledge, and how you are interpreting your knowledge, how you are applying the knowledge into day-to-day clinical practice. That's what they're looking for. So don't think that we need to know about 25 differential diagnoses for certain things. So it is expected as the foundation trainee doctors level. So you will be expected to join in the foundation training second year. So you will be expected matching with the foundation doctors in United Kingdom. I was a foundation training program director for nearly 6 years. I was more academic foundation training doctors. When the doctors from India are coming, so they are far, far better knowledgeable than the academic foundation trainees. But you need to demonstrate that I have the adequate knowledge, I have the skill for me to function level as a foundation doctor. So when you are preparing, I would suggest to recommend to read this GMC Good Medical Practice, because these questions, answers, and also lots of scenarios are based on the general medical practice and good medical practice. There are code of medical practice, which we are following strictly, we have to follow. And make sure you care for patient is your first concern. Patient safety is your concern. That is what you need to. Here, everything is patient, then only everybody comes after that. So patient safety and patient care. And you need to be competent and keep your professional knowledge up to date. Yeah, you need to continuously attend the CME programs and reading journals and make sure that you are updated on that one. And you need to take prompt action. If I am doing something wrong to my patient, I can be challenged and immediately. And because the doctor who's working with me is worried about the patient's safety. So patient safety shouldn't be compromised. So when you see this one, you register in your mind, these are things. Then when you're preparing for an exam, you understand these are the questions we'll be asking on that one. And you need to maintain good team relationship with your patients and colleagues. That also be tested, whether you will be a good doctor, you're working as in a professional, open, honest manner in your day-to-day life. So there is a Plab test blueprint available on the GMC website. You can download and read that blueprint, which will also help you to prepare. These are things which will be, for example, they will capture patient with fatigue. And they are asking into what is in cardiovascular fatigue is heart failure and chest pain. These are things which you'll be looking for. Acute myocardial infarction, coronary angina, etc. Like that, everything is child health, failure to thrive. These are the blueprints. So you just prepare like that will be useful for you to understand that one. So it's mental health, musculoskeletal medicine, or neurology, blackouts and faints, cranial nerve problems, falls, because falls is very common here and elderly populations and things like that. So you just remind about the scenarios and that will be tested in your exams. And so that's a Plab. The Plab consists of your assessing your knowledge and also skills. The part one will be assessing your knowledge, how much you have the knowledge, and part two will be assessing your skill set, including communication skill set, including the way which your body language, way which you behave as a doctor, and your performance in day-to-day work to say you are a safe doctor. So these are the key principles are assessed. So your knowledge in part one, skills and performance in part two. So these are the knowledge and skill set. Again, I'm going back into the General Medical Council's domain. So you go into that, what are the knowledges you said? Your knowledge is how you're targeted history taking and how you're doing a focused examination, how you're doing a practical procedure. These are all be assessed. And then how you interpret investigations, how you request investigations, and how you interpret investigations. That's all you will, because here it's a government pay for everything. So you can't simply request investigations. You need to justify that investigations if you are requesting. You need to say, is this investigation is going to change the management plan of my patient? Then only you request an investigation. You can't simply request all the blood tests which you wanted. So that is where they will be testing you. In India, we are used to, yeah, let's do a CT scan, let's do an echo. Here, you need to justify. So there's a domain two. Two is always patient safety and quality. And this is what you can see that patient quality assurance and safety is also assessed on that stations. And then domain three is communication skills and team working and teaching and training. They will be even assessing how you are teaching, how you are training other people. So there's lots of time. So now I just tease on your part one question, because this is a simple question which they asking for a scenario. They always also clinical scenarios, common clinical scenarios they will give. A 22-year-old man, acute painful red right eye, blurring of vision, similar episode a year ago, episodic back pain with stiffness by exercise, and the pain is get better by exercise, and he was taking diclofenac for 4 years. Then they show you what is the most common reason for his red eye. So basically, they are here, they are giving, if you read the question carefully, you will be saying that patient had episodic nature of back pain. That means the patient is getting some form of inflammatory immune-mediated back pain. That's why he's stiff, and it is better by activity or anti-inflammatory tablet. So then you think about is a 22-year-old male, so it's a young man, back pain with stiffness. When you think about ankylosing spondylitis or spondyloarthropathy, and then you think about what is this cause for the red eye? Then they're asking about, is it what is this cause for the red eye? Then they will give you, is it chorioretinitis? Is it conjunctivitis? Is it episcleritis? Is it iritis? Or is it keratitis? So when you see these answers, when you're reading this one, so three things you can easily eliminate. It is not conjunctivitis. Yeah, it is not chorioretinitis because nothing commented about retina. So then you're coming into episcleritis, iritis, keratitis. So there is a distractor in each question. There is a common things also. So you eliminate them and then you reach one answer very easily. So what is the common things happening in ankylosing spondylitis? It's iritis. So like that, you will be going for in. Is another questions. 18-year-old woman thinks she is overweight and has mildly depressed mood. For the last month, she has reduced food intake, has been exercising 2 hours each day. She had amenorrhea, body mass index is 15.5, blood pressure is low. What is the single most appropriate management? So when you read the STEM, you will understand this is an anorexia nervosa, which is what they're talking about. So you read the question, understand what is the STEM, what is the diagnosis, and then you go and see about what is this, refer to eating disorder service. So, or you refer to dietitian. So that's most appropriate management. That's what it is, single most appropriate. So they use certain words in multiple choice questions in England. So you identify them and then answer the questions. And when you're talking about the past results, it's very positive to see. In 2020, which is last year, and these are the candidates appeared for Plab, around 70% passed in their first attempt. Yeah. So this is very important because you have only 4 attempts to pass the part 1, and that is valid for only 2 years for that. So you need to carefully timing everything, and you need to, because it's quite expensive exams. It's not exam you keep on writing and paying money, which is very difficult for you to manage. So the exam results are good, 70%. I must say that when they divide and broken down into different international medical graduates, the success rate was very high from people from India. All exams, for example, even for a MAS-EP or for a Plab exam, its success rate is mainly international medical graduates. Indian origin is a high pass rate, which we are all very proud of. So then next one, when you pass part 1, you will be automatically advised to go and book your part 2 exam. Part 2 is then only done in England. So you need to come to Manchester to write the exam. So this is objective structured clinical evaluation, which is called OSCE. These people in this country, undergraduate level, they are tuned to this. So they are very, very used to that exam style. We are not particularly. So there are stations, the stations are changing, but you need to pass certain stations. And a lot of stations are talking stations, and some stations are with actors. Some stations you are expected to do some procedures, etc. So this is what they will be asking. You are a foundation 2 doctor in rheumatology unit. You are told that patient James Horton referred by GP with the pain in his toe. Yeah. So in a rheumatology, in a pain in a single toe is what is it? And you are not given any other information. And then you must assess the patient and manage the patient. You will be given 8 minutes to complete the scenario. So the timing is very important. So you need to read that one. Your presence of mind will come straight away. Yes, it could be gout. So what should I do? I need to talk to him about the alcohol intake, lifestyle modification, etc. So that's very structured, non-pharmaceutical management and pharmaceutical management, which you need to be talking about that. So what is assessed in ASCII or Plab Part 2 is how you gather a data when you are taking a history, and how you have a technique in doing certain procedure, how you are assess a patient, whether you are assessing urgently or you are taking relaxed on that mode. So assessment skills will be assessed. And how you're managing this patient, which including how you request investigations and how you are managing these, interpreting the results, which will be also assessed. So, and then interpersonal skills, then you may say that I would like to ask my senior colleague, because nobody's expected you to make a judgment call. You can always seek help from your seniors. That's what you need to show. I will seek help from my seniors, and that will help you too. So find a history of acute recurrent monoarthritis response to inflammatory drugs, and find a medical history of any medication, trauma, find out appropriate lifestyle, and make a diagnosis of possible gout. So it's information gathering, identify any correctable causes, and then make a diagnosis on that. And you need to plan appropriate management. So we all do up to this in India, there's no problem. What we don't do is patient concern, and also you need to listen appropriately and show empathy on them. He may have said, no, you can't drink alcohol, you can't do this, you can't do this. We will tell in India, here you can't. You need to listen to the patient. Yes, of course, I know you have drinks excessively, but can you please get down, come down, and show in a very empathetic manner, saying that, yes, of course, you can have it for birthday, etc., but not all the time. Can you able to cut down? In a very polite, very empathetic way, you could able to do will be easy to do that. And then conduct the consultation very fluently and professionally. That's what they're expecting in your part 2 Plab 2 exam. So that's where you wanted to come and do some clinical observership, which also help you to see how the senior doctors and junior doctors are interacting and talking to each other. So as monoarthritis, I'm not going to come, common diseases are common. We always talk about anything, chest pain, sudden onset, it must be a myocardial infarction. That is what you need to rule out. Like monoarthritis, rare syndromes, you don't expect it to tell, and rare diagnosis not expected. Common disease are common. That's what you need to think about. Think simple. Don't give a fancy diagnosis of, it could be subacute combined degeneration of cord or something like that, or, something which is not common. They don't keep anything very rare for you. They are testing you as a undergraduate level, not postgraduate level. And you need to have that sort of presence of mind on the station when you're performing. And, you have to correlate very well on that one. So take-home message on that was read instruction carefully in the station. Keep up with your time by practicing. Don't worry if you did a mistake in one station, you can catch up the other stations. So don't get panic because you pay a lot of money and you're stressing, all sort of things. Don't get stressed out and move on and complete the exam properly, which you'll be able to do that. So the part 2, you can see that Plab 2 exam is mirror image of the part 1. So you are passing part 1. That means you have knowledge. And when you come here, you have some skills acquired by your courses, etc., and clinical attachment. And you do these results are around 65%, okay, in first attempt. And it is important. This number of candidates are passing is very good now. And results are good for people because they prepare well. Exams have become easy. They prepare well. So in attempts, which you're talking about, first attempts, 81% passed. Yeah. So it's a good results. You can. So be positive and, all the fourth attempt, if somebody is not passing first attempt, it's always a little bit tricky on that one. So how do you prepare? Simple. Concept oriented, which I explained to you what concept you need to do and your qualification. And you go with that. Okay. Don't come and present like an MD student. I have to answer this question like you just present like an undergraduate student in your Plab exam and you'll be able to do that. So lots of books, but these are the small books which I would suggest to read. You don't need to read Davidson or Kumar and Clark or Bailey and Love, straight and page to page. There are clinical specialties book. There are Oxford textbook of clinical medicine and specialties. These are 2 books you start reading from today, which will take you there for your part 1 and part 2. Take some simple notes here and there, which also help you to prepare. But keep it simple. You don't need to do much. And here you learn from work and you learn and improve your knowledge by listening to other people and attending various seminarios, etc. The take-home message here is Plab is achievable. Okay, don't worry. If you are planning for, then you believe yourself and you can achieve that. If you start right preparation at the right time, you could do that. You approach the exam with a clear frame of mind. Don't get yourself stressed. With a clear frame of mind, you would be able to do that. So my journey is in 1997, I passed Plab with some difficulty, an MRCP after that, and then gone into FRCP and consultant rheumatologist. I'm an MRCP examiner. I'm an MRCP rheumatology board member. Sorry about the spelling mistake. And I'm a honorary professor and professors. And I do lots of writing and publications, which is continue. So I achieved all this from my Plab. If I didn't pass Plab, I wouldn't have achieved that. So your Plab journey is only an entry point, but you can, once you pass Plab, you can achieve more and more, and it will give a lot of immense satisfaction. You train juniors, you teach juniors, you research and you publish, and you also assess your candidates internationally, which also give a great feeling for you.
So it is doable. So I will introduce now to Sai Niranjana, who is just passed the Plab Part 1 exam, and she also passed her Part 1 MRCP CH exam at the same time. So Dr. Sai Niranjana Sai Gopalakrishnan is graduated from and
Thank you.
I'll ask her to present her experience for two people to share. This is just you people to give some motivation. And I got another doctor who's waiting to talk about her experience or a journey as well. Over to you, Niranjana.
Yes. Thank you, Dr. Moorthy, and thank you, IMA, for this opportunity. So I'm Sai Niranjana, and I graduated in March 2020. So I will be giving you an idea about how to prepare for Plab and the other exams, and I'll also be sharing a few materials with you. So let's cut to the chase. Like Dr. Moorthy said, IELTS, the English exam, is the first step. So for preparation, I didn't really go for classes. I would advise everyone to go through a few channels in YouTube if you're comfortable with that. There are really good channels. One of them is called IELTS Advantage, which would be really useful. And another channel is called IELTS by Liz, L-I-Z, Liz. So these two channels were extremely useful for me. And I'll give you, you should prepare for at least 3-4 weeks, depending on how good your English is, and also plan your exam quite well. So I planned my exam 3 months before I graduated, because I knew that only if I pass, I would be able to book my Plab 1 seat. And getting a Plab 1 seat during COVID is quite hard. The waitlist is huge. So I wrote my exams in Jan because I was graduating by March. And another thing is, by chance, if any one of you miss your IELTS in your first attempt, that if you're not able to pass in any section, this 3 months will also give you time to retake the exam if by any chance you miss one of the categories. So these two channels and the book that the British Council gives when you register for the exam would be extremely useful. And there's a book called IELTS by Cambridge that is also quite good. With this, I think it should be easy to pass the IELTS exam. I haven't written OET, so I'm not really sure about that. But for IELTS, this should be good enough. And the next step would be Plab 1. So once you pass, you'll have to register in the GMC website. And for Plab 1, please give yourself at least 3 months to prepare, so that for 2 months, you could sit and learn everything. And the last at least 3 weeks to 4 weeks, revise everything quite well. I personally did 2 to 3 revisions. And also, you can do a lot of mocks, model exams, because time management is crucial. There are 180 questions and 180 minutes for the exam. So for Plabable is the app that I used. It's spelled Plabable, Plabable. And that app is like the Bible for Plab, because most of the questions they ask in the exam are similar, at least the pattern is similar. So that app would be extremely useful, and it's reasonably priced. It costs about 2,000 rupees for 4 months. And the exam fee for Plab 1 would be £250. And for IELTS, the fee would be around 18,000 Indian rupees. So these exams are quite expensive. So it would be good if you could give yourself the time to prepare and then appear for the exam. Other than this Plabable app, if you want to go through, you could go through Oxford Handbook of Medicine, which Dr. Moorthy suggested. But it's personally, I felt that it's quite hard because there are multiple topics, very precise. So I preferred making notes from the app, the multiple choice questions. And there are a few other apps like Pass Test, Pass Medicine, but I would always advise finish Plabable first. And if you're comfortable, then go for the others. Be very crucial with time. Time yourself and do the mocks well before so that you can be comfortable with it. And unfortunately, it was during COVID that I finished my Plab 1. So to get a date for Plab 2, I had a 1-year gap, and there was nothing that we can change about it. So I just turned all that frustration and anger into just making it useful for me. So what I did in that 1 year was I used the first 9 months to work, because in UK, when we finish our Plab 2 and come, our CV stands for ourselves. We have to have a good CV to get a job. Otherwise, we would waste another 3-4 months just hunting for a job. So the first 9 months I worked, and the next 3 months I used it to clear a Royal College exam. I am personally interested in pediatrics, so I chose to write the MRCP-CH exams. I'll give you an example. So I prepared for 2.5 months for this pediatric exam called Foundation of Practice. And the pass mark required was 65. And the mark that I scored was 79. I am not telling this to show off or boast about it, but this is for my fellow friends who think that these Royal College exams are only for postgraduate students or those who have immense working experience. No, I am a graduate with almost no experience in pediatrics. And if I can prepare and write it, I'm sure every one of you can. So please use the time wisely. And if it is general medicine that you're interested, you could go for MRCP. If it's surgery, you could go for MRCS. But you could always attempt it, and it is a passable exam and it is an achievable target. And another thing you could do, which I did, was come to the UK for a clinical attachment before my Plab 2 exam. So we can get a visa with Plab 2 exam as our need for the visit to UK. Dr. Kader will be talking to you about how to prepare for Plab 2 exam. So what I would say is, before that, if you could get a clinical attachment, it would be extremely useful to see how the UK system works, which, believe me, is different from India. It's unique in its own way. And how to apply for this clinical attachment is simple. Any hospital, you can find their HR email ID when you just put it in Google. So just get their HR's email ID and send out a formal mail with your CV. It's okay if there isn't much on the CV, but the basics about what you've done and how you've graduated, and just send it to their HR. And eventually people will reply. Because of COVID, it is a little hard to get a clinical attachment, but if you can, even if it's 3 weeks, 4 weeks, it would be extremely useful so that you can see how things work. And another thing we could do in this time is, if you have a break, especially now because of COVID, you can always do a research or a clinical audit. That is something that I did. So I published it in an international conference, but it took a lot of time. So if you have the patience and the perseverance, even if you do a simple study, people here value it a lot. So that would be look extremely good in the CV that we publish, we eventually put out when we try for jobs. And if there is any conference that you could attend, be it virtual or in person, please do that so that you can add up these things to your CV while you prepare. And lastly, with regards to this Royal College exam, the requirement for that is that we have to be a medical graduate. So just with a degree certificate, when we upload it, we can write our exam. So you could always look out and see the materials needed and always prepare for it, because even if the exam gets postponed due to the current COVID status, which is rising again, we could always do something so that we can make our CV better. And thank you for this opportunity. I hope it was useful for you all. And if there are any questions, I'm open to it.
Thank you, Niranjana. Thank you. That was very comprehensive on that one. Let me introduce the next person who is just fresh from her Plab, and her name is Dr. Safika Kader. She graduated from Trichy Government Medical College, and she also aspired to be a pediatrician. And she now passed a Part 1 and Part 2 and registered General Medical Council, had got a visa sorted out, and now she got a job at Royal Free London Hospitals in London Pediatrics. And I will invite Safika to share her experience as a journey, start from her Plab. Over to you, Safika.
Thank you, Dr. Moorthy. Am I audible?
Yeah.
Yes. So a very hearty welcome to all of you, and thank you for joining us today. And thank you, IMA and Dr. Moorthy, sir, for giving me this opportunity to speak. I am Shafiqa, and I'm an international medical graduate, soon to start as a junior clinical fellow in pediatrics in Barnet Hospital, which is in North London next week. I'm here to take just 5 minutes of your time to discuss my experience, and I hope that it helps you guys in your journey as well. So a bit about myself. I graduated last year in March from Trichy Medical College. And after that, I spent around 2 months trying to decide which route to take, whether to study for NEET-PG or not. And I felt like coming to the UK was something that I would really enjoy. So I started preparing for my IELTS in the starting of July last year, and I booked my exam for August 6th. So that gave me 1 month of preparation for my IELTS. And by that time, I was not working, so I dedicated my entire time to studying IELTS. I usually used the Cambridge books. Now, that is a series of 15 books, and each book has 4 tests. So I started with the latest, which is the book 15, and I went backwards. I solved around 4 to 5 books. And I also saw videos from IELTS Liz and IELTS J. They are all free on YouTube. And I also got my writing essays professionally corrected by a tutor. All of this helped me achieve an overall average of 8.5 in IELTS. And after that, I went on to book my Plab 1 as soon as I could, but I still could not get a seat in India. So I booked my Plab 1 on November 5 in Dubai. And that gave me around 3 months of time for me to prepare for my Plab 1. And this time I also started work as a junior doctor at a urological hospital. And I spent most of my time reading Plabable and Plab Routes. Now, Plabable is the MCQ, which is the holy grail, and you need to solve it at least 2 to 3 times to get an idea about the concept, because all the questions are not going to be exactly the same as they are in Plabable, but it helps you strengthen your concepts, and 80% of the questions will be the same, the concepts that you have used in Plabable. Plab Routes is the notes that I read. There is also another version of it called Plab Keys. You can use either of these, whichever you want. And I spent the last 20 days doing mocks. And please make sure all your mocks are timed, because the questions in Plab 1 are quite easy, but where you struggle is time management. So you need to make sure that you do mocks and they're always timed. Plabable itself gives you a set of 12 mocks, and you can also do mocks from other sources. You have previous sample papers that you can sit and try to solve within the same time period. So after I cleared my Plab 1, I booked my Plab 2 for July 29th. So there was around 6 to 7 months of gap. I was focusing on my work at that time and also preparing for my Royal College exams, which is MRCPCH, because I'm interested in pediatrics, that I'm going to hopefully attempt in February next year. So for my Plab 2 preparation, I joined the Aspire course in May, which is the online course for 2 weeks. I was supposed to come to the UK at the end of May, but because of COVID, I could not do so, and I ended up coming into the UK in the beginning of July. And I also did my ECFMG or EPIC verification during this time, because you really need this for your GMC registration, and I would advise you to do it after you're done with your Plab 1. So before COVID, the regular routine for Plab 2 was coming into the UK 2 months prior to your exam, attending the academy live for 2 weeks, and then spending 4 to 6 weeks in the academy practicing in person. But because of COVID, this has not been possible. And I was really panicking about this, because I came into the UK only 3 weeks before my exam. So I really want to stress on this fact that it is not necessary for you to spend 2 months in the academy. 2 months of preparation, which can be done back home, is totally enough. All you need to do is come into the academy for 10 days so that you can practice all your SIMMAN, all your examination stations, and you will be good to go for your exam. Just make sure you take lots of mocks. I took 5 mock exams, and that really helped me. And I cleared my Plab 2 with 13 out of 16 stations. So it was quite comfortable. And my entire preparation was around 2 months, mostly with a partner online, over video calls. So after I got my Plab 2 result, I applied for my GMC registration. For me, it was quite straightforward because I was a fresh graduate. So I got my registration within 1 week. And then I got into a clinical observership in the starting of September in pediatrics in Stoke-on-Trent. So that is the time that I got my registration and I started my observership as well. After I joined observership, I did my advanced pediatric life support course, APLS, because I was interested in pediatrics, and also the safeguarding course, which really helped me boost my CV. And during this time, I was also applying for jobs. So within 1 month of my GMC registration, I had applied for a total of 40 jobs, and I was called for interview for 6 of them. I attended 2 interviews, and I got 1 job offer in my dream specialty, which is pediatrics. So the time between my registration and my first job offer was just 4 weeks. And this is I got a job in pediatrics even without having any sort of pediatric experience or any MD degree or anything of that sort. It's just how you show how focused you are in that specialty and how you do in your interview, and how you write your CV, because that is also something important. Unless you write your CV properly, you are not going to be shortlisted. And 2 months later, I had now sorted out all of my paperwork. I have found a nice little home that I can move into, which I'm going to move next week and start work in Barnet Hospital, North London. At the end, I just want to say that my journey was filled with a lot of obstacles because of the pandemic. But now when I look back at it, I feel like it was all worth the effort. And I just hope that it inspires you guys as well. Thank you.
Thank you, Safika. Thank you very much for that true reflection of your journey. So what we would like to let you know, because it is an achievable thing, and we are happy to help you further. That's my email ID. You can connect me on WhatsApp, also in the Telegram group. So it's IMA is done a good job. I'm sure you all get benefit from this sort of a session. And the floor is now open for any questions, and I'll hand over to Venkatesh.
Thank you so much, sir, for such an excellent and wonderful session. Thanks to Dr. Sai Niranjana and Dr. Shafika Kadil for sharing their experiences as well. Hope the knowledge gained from this webinar will be of immense help to our junior doctors, especially those who always wonder about how to get into NHS. Thanks a lot, sir. Thanks a lot, ma'am, for your time, despite your busy schedule. So we are coming to the end of the session. Let's take a few questions from the audience. Audience, please start typing your questions. In the meanwhile, I would like to invite all the participants to our IMA JDN's next event on 5th December, that is Sunday. We are organizing a national quiz in collaboration with eGurukul. We have exciting cash prizes for the winners, and moreover, I'm sure it will be a great exercise for the NEET and INICET aspirants. You can find the registration link for the quiz in IMA JDN Facebook and Insta pages, as well as in my personal profiles also. So coming back, I'll just read out the few questions in our chat box. Our speakers will try to answer. So first question is that, sir, Dr. Elizabeth has asked, is there, if there is a gap in my house surgency of 2.5 months due to valid reasons, will that be a problem for GMC registration?
Yeah, it's a good thing is, as Niranjana was mentioning earlier on, you shouldn't be having a gap, or you should be able to substantiate your gap, because the GMC will be very carefully looking for any gaps. And you can't say that I'm sitting and preparing for NEET for a 1 year or something like that, so that won't be accepted. The acceptable level of GMC absenteeism is around 6 weeks, not more than that. Yeah, moving between jobs, etc. So it is important you keep a continuity of your CV, and saying that I'm working as a junior doctor, I'm doing a clinical attachment, observership, or something like that. You have to be in continuous medical practice. So definitely 2.5 months may be okay, but longer is not advisable. As another point I would like to make sure about Dr. Kadir's point as well is, you need to get your CV ready. while you are there in India. Like, you get some presentations, attending a quiz like IMA quiz, get some prizes and put in your CV. Yeah, I'm continuously engaged in the academic activities, doing some research work or small project work, and then building your CV and procedurals, because CV writing is very different. In CV, a lot of people, when after passing Plab only, they will be writing CV. I would suggest when you are started writing your Plab exam, get your CV ready, because CV speaks a volume. Nobody knows you, and your CV will take you there. So get your CV ready for as well.
Okay. So I always had this doubt, how much page one CV can be? Because there is, when I'm submitting some CV for some purpose, they're telling that it should be maximum 1 or 2 pages. Like, what is the difference? What is the difference between a job CV and an academic CV? How it should be made? Can you please help with this?
Yeah. The CVs are, as I rightly said, there is no fixed format of a CV, and it could be, I was asked to submit my CV last week for some other thing, which is for a research grant, which was around 38 pages. But you don't need to do that. But you need to 1.5 pages also some when you submit for a grant. So it's all variable. But what it is about is the tailor-made CV is important. So if you're applying for a pediatric job, so your name, age, qualification, contact details, that's first thing. And your personal training, so far how much you trained, what is your additional qualification, prizes, awards, and publications, and you need a reference. So simple layout, you can do a CV, should be fine. It could be a couple of pages or 3 pages, but it should be demonstrating when you are applying for a job in the UK, you have to show your qualification and training and procedural skills, teaching and training experiences, and any audit or project work which you have done. And then you need to make sure, like the advanced life support courses and things like this, also carefully looked into the CV.
Okay, sir. Thank you, sir. So Dr. Elizabeth has also asked, sir, what is the scope of an ENT surgeon in UK who is a fresher from India?
If the person has finished an ENT, then there is a different route they can come. Surgical specialty, every specialty people want, there is need for that. And if you are doing, just coming from fresh undergraduate and then wanted to get training into ENT, you can get into training into ENT through core surgical training route. So for that, you need to get a foundation doctor post, and then you need to go surgical training, and then you go to subspecialize into ENT. So you have to get into the training scheme. Obviously, you need to have necessary qualifications and things which will take you. If nothing is not doable, everything is achievable. When I started, there's people who used to say surgery is very difficult, but nowadays I can see few of my junior colleagues are got into surgical training in their 3 years of rotation. So it is getting into the right path at the right time with your right qualification.
Thank you, sir. Next question is from Dr. Vaishna. Sir, is it possible to join the NHS as a public health trainee if I complete MD Community Medicine in India? If so, please explain the procedure.
A very good question, which is, it is, the public health medicine is different track it is going on. I know Venkatesh is also public health, and people from public health is also needed in England. And obviously in India, the public health is different, and UK public health is completely different. Here it is more social care plus public health. And there are public health doctors are there. And for each county, there is a public health doctors are required, and there is a scope for that as well. A lot of public health doctors, after they become into that, they become into more administrative role rather than a clinical role. They will become like the chief medical officer role. There's all the people are public health doctors. And each county, each district, each place is there. So there's a lot of need in that as well. I know a few Indian doctors are doing public health, but I do not know completely about the public health, but I'm more than happy to connect you to those, my contacts of public health, for you people to get advice more.
Thank you, sir. Thank you so much. So Dr. Akash has asked, sir, presently I'm in 3rd year now. How can I prepare from now on?
3rd year is too early for preparing for Plab. I would suggest when you come to housemanship or a CRRI post, then you start preparing for your Plab. When you're doing, like, for example, the CRRI time, you start focusing on Plab. Your first aim is to get your final exam in your MBBS. So 3rd is too early, but I won't discourage you. You have your vision clear. when you start from the housemanship, you start preparing for IELTS, Plab, and everything, because every exam is valid for only 2 years. Yeah. So when you write your IELTS once you finish your MBBS, then you have only 1 more year before you write everything. So it is all time consuming and time limit as well. So I would concentrate only after your CRRI or during CRRI.
Okay, sir. Thank you, sir. Dr. Elizabeth has asked, can you guide us on how to do research or clinical audits?
Yeah, it's a good thing. Research and clinical audits are two different things. Okay, research is where you ask a question and find an answer. That is a research. Okay, whereas the audit is you have a set standard already there, and you see whether your practice meets the standard, which is audit. So there's a line overlap in between research and audit. So you need to divide yourself. What question I'm asking? Is it an audit or a research question? So as I said, research is the question which is not answered before, which you are trying to find an answer. Audit is some already been there, which you are trying to see whether you are, for example, you are following the protocol for thromboembolic prophylaxis before hip surgery. There is a protocol there, and you do it audit according against that. You can do that same thing in India and same thing in whichever place you're working. Research is like, as I said, because Niranjana did a small piece of research work with us, but she was comparing how the alternate medicine is practiced or used by people in rheumatology, comparative data from India and UK, which she has done and she published. So that is a research sort of thing, small piece of research. Whereas you advise about a medicine, or they're taking the medicine regularly, what are things you said you are expected to tell, and then you audit against them is an audit. So audit doesn't complete without the re-audit. So you need to do an audit and then identify the default or the problems and then improve the system and then re-audit and then complete the loop. That is audit. Both of them are valid, and they expect you to do some sort of a quality improvement project, which you can do it in India before you come. Also research.
Okay.
Thank you.
Thank you, sir. Sir, our next question is from Dr. Manoj Aryan. Sir, if I have finished my PG in India, what's my route to super specialty in UK?
Yeah, the PG in India will take you, if you are interested in, for example, if you're interested in rheumatology, so you finish your MD General Medicine and you're interested in rheumatology specialty or gastroenterology or diabetes or cardiology for that matter, there is a route which is called Medical Training Initiative Scheme, which is called MTI scheme, which you can see more information through the Royal College of Physicians website, and similar in surgery and obstetrics, etc. What you need to do is you have to get a job through someone from the hospital here, or your college will find you a job, and then you need to go through IELTS, and then you come over here with the GMC registration only for 2 years. The contract is after 2 years, you need to go back to India and practice whichever specialty you've been trained. Some people will go back and then come back, because by the time you will finish your MRCP easily because you got your MD or post-graduation, and then you got 2 years of rheumatology or whichever experience in this country, which allow you to prepare for MRCP quickly. So once you got MRCP, then you got a permanent registration through GMC. So you come back to India and then reapply and you will get a registration. So then you may get, you got MRCP, you got rheumatology experience 2 years, then you can become a consultant in a different route as well. There is a different route, but obviously it is also possible.
Okay, sir. Thank you, sir. Dr. Kishore Saran has asked, sir, how much the total cost of the journey before getting the job?
Sorry, I didn't get it that.
Sir, how much is the total journey cost before getting a job in NHS?
Okay, I'll pass on to Sai Niranjana for that, because I didn't spend any money recently. So Niranjana, you are mute.
Yeah.
You give a rough estimate.
So, yeah, let's start with IELTS. That would cost us about £180, which is 18,000 rupees. And for Plab 1, you will have to spend £250, which is 25,000 rupees. And for Plab 2, another £890, which is 90,000 rupees. So 90 plus 25 plus 18,000. This is the exam expenses. Apart from this, for preparation with apps for Plab 1, the Plabable app would cost around 3,000. And for preparation for Plab 2, people usually prefer some academies like Swami's Academy or Aspire. And those courses, they charge us about £650. That is 65,000. So these are the expenses with regards to exam and preparation. And your flight ticket, usually it's subjected to the time you fly, but I would say at least save 60,000 for your flight to and fro. And accommodation, again, it depends, but per month, at least if you're sharing, you would have to spend around 50,000-60,000 for accommodation here per month. This would be the rough estimate. Thank you.
Okay, thank you, ma'am. So we will take the last question. So what is the scope of community medicine in UK after MD?
Yeah, this again, they are community medicine is also going through the public health one, and there is an occupational health physicians is there and community practitioners are there. There is the community medicine which you're talking about is like our SPM for doctors in India is also there, similar to public health doctors. The community practitioners are what we call primary care practitioners, which is very well wanted, is called these general practitioners. So they are in primary care. So they are one who will deal with everything. They're also called community doctors as well. So I'm not which one he's asking about. He's asking about public health or community medicine. But if it is a community primary care health, there's plenty of jobs available and plenty of opportunities available too.
Okay, thank you, sir. Thank you for patiently answering all the questions. Thanks to Dr. Sai Niranjana and Kader ma'am for actively answering in the video as well as in the chat box. So moving ahead, we are coming to the end of the session. Now I request our National General Secretary of IMA Junior Doctors Network, Dr. Karan Juneja, to give the vote of thanks.
Thank you so much, Venkatesh, for this informative session with our respected Professor Dr. Moorthy sir. It was very informative. I thanks Sai Niranjana ma'am and all this panelists who have joined us today and all the panelists who have joined us today. Thanks so much, Shiv sir. And I hope all the delegates had a great time listening to Professor Moorthy sir. We are very much thankful for your time, sir. Thank you so much. Thank you so much. Thank you.
Thank you so much. Once again, I thank Dr. Arumugam Moorthy sir, Dr. Sai Niranjana, Dr. Shafika, Dr. Abulasan sir, Dr. Jainal sir, Dr. Shiv sir, Dr. Karan, and all our participants for making this webinar a great success. Thanks a lot, everyone. We are closing now.
Thank you. Thanks very much. Bye now.
Thank you.
Thank you, Moorthy sir.
Thank you. Thank you.
Thank you.
Okay. Thank you. Bye-bye. Thank you, Sai. Thank you. Thank you, Amina. Thank you. Bye-bye.
Thank you. Have a nice day.
Bye-bye.
Thank you.
Bye.
Bye.